Welcome back. High blood pressure. What is too high? And here to help me decide that is Kristy Salley, a nurse practitioner with Lexington Cardiology Baptist Health. Welcome.
Thanks for having me.
Now, you just got a new certification that deals with blood pressure. Tell me about that.
I did. Well, as you know, hypertension or elevated blood pressure is a major risk factor in cardiovascular disease. And of course, it's also associated with other medical conditions such as coronary artery disease, diabetes, obesity, peripheral vascular disease, chronic kidney disease, tobacco use, and advancing age. The prevalence in Kentucky is about 10% higher than the national average for having high blood pressure. So because of this, that's what kind of drew me into wanting to get certified so I could better serve the community and be able to help patients better manage their blood pressure. So I decided to get certification in hypertension. So I got this through the American Hypertension Specialist Certification Program, and from that, then I decided to start a specialized hypertension program within our cardiology group at Baptist Health Lexington.
And you are the first or the only nurse practitioner with that certification in Kentucky.
That is correct.
Well, okay, because there's a lot of people in Kentucky who have high blood pressure.
Very much so.
So what numbers do we worry about? What's a normal blood pressure? What's a high blood pressure?
Well, the current guidelines recommend to try and go for a target blood pressure if you're less than 65 years old of less than 130/80. And if you're over 65, they recommend less than 140/90.
Okay, so do you know, other than taking your blood pressure, we talk about that in a minute,
okay,
do you have any symptoms? There's some reason that you think, well, my blood pressure's up?
Well, sometimes patients can have headaches, dizziness, even fatigue, but oftentimes people don't have any symptoms at all, and that's what makes this so dangerous, is because you can have vessel or organ damage and not even know it. And that's why hypertension has often been termed the silent killer.
So, you know, the first idea you may have high blood pressure when you have a heart attack or find out your kidneys aren't working.
Right. I mean, you could have both.
All right. So, how do you take your blood pressure? What's the process of making the diagnosis?
Well, as far as, you know, taking your blood pressure at home.
Is there a certain time, a certain way, a certain cuff that you should use?
Yes. You should take your blood pressure in the morning when you get up. I would try and take it at the same time every day so it's consistent.
Okay. How about the wrist cuffs? Are they as good as the arm cuff?
No, not at all. They're much more inaccurate. So if given the choice, I would definitely prefer having a cuff monitor. And then when you take your blood pressure, you need to be in a relaxed state. You need to be sitting for 5 or 10 minutes before you take your blood pressure. You need to have your feet on the floor. You know, don't have your legs crossed, and not be eating, drinking, talking while you're trying to take your blood pressure. And try and have your arm with the cuff at heart level so you can get a better reading.
A lot of my patients, when they're in the doctor's office, their blood pressure is a little high. That's why you mentioned taking it home is really sometimes a good way.
Yeah, they found that home monitoring of blood pressure is very beneficial and accurate. And sometimes it can be more accurate than what you get in the doctor's office, because people are often anxious and nervous.
So, if you make the diagnosis of high blood pressure, how do you treat it?
Well, you can start out by making some simple lifestyle modifications. Weight loss would be probably the first one. You can try and limit the salt that you have in your diet. A lot of patients don't realize that things like canned soups or processed foods like TV dinners have a lot of salt in it. You can also decrease the fatty foods, fried foods. Try and increase your physical activity. If you try and walk for 30 minutes a day, 4 or 5 times a week, then that will help as well. And of course, abstain from any tobacco or alcohol use.
Okay, what are some, you mentioned some, but focus a little bit on what does high blood pressure cause? What are the end organ problems that we can see?
Yes, it can cause different organs to fail. You can, long term, it can make you go blind with the vessel damage in your eyes. You can wind up having strokes, heart attacks, heart failure, even kidney failure.
So it can affect everything.
It can affect everything.
And worse comes to worse, medication.
Right, and it's also very important for patients to take their blood pressure medications as prescribed and to not miss doses.
All right, that's great information. Appreciate you coming in, and congratulations on your new certification.
Thank you so much. It's a pleasure being here.
Thank you. Check your blood pressure. We'll be right back.